Hello, and welcome once again to the Dental Marketing Mastery Series. This podcast is brought to you by dentalwebcontent.com and New Patients Incorporated. I'm Howie Horrocks, the founder of New Patients Incorporated. Along with me once again is my friend and partner and the president of New Patients Incorporated, Mark Dilatush. Hello, Mark. How are you today?
Hey, Howie.
What are we talking about?
Well, we started on common mistakes.
Oh, yes.
And we gave it the nice, friendly disclosure that we love all dentists and all dental teams. And we even almost got to the point where we changed it from common mistakes to common some other nicer word. But the reality is that the majority of dentists are out there. The vast majority, are directing their own advertising. They're directing their own content. They're directing their own look. They're directing their own feel. They're directing their own orchestration, their own deployment. They're basically directing everything on their own. The majority of dentists are. I mean, our company only serves a half of 1% of dentistry. So obviously, at least 99.5% are out there either doing no advertising or directing their own, or maybe they're going through a different organization. It's more than just us, obviously, but
Yeah.
let's all agree that 95% of dentists out there are directing their own advertising strategies, budgeting, choices, content, written, graphic, media, deployment timing, deployment volumes, orchestration, everything. The doctor is responsible for all of that.
Right, and I think that's even true if the doctor is delegating it to someone in the office,
right?
Or maybe a private vendor or something like that, and that actually leads us right into another mistake.
Right.
They're getting input from various sources, or they're getting input from themselves, and there are some dentists, let's face it, who are not real savvy about marketing. There are some who are.
Right.
So this combination of things and input that they're getting from everybody, including the janitor, can lead them astray. Let's put it that way.
Right. Okay. So just so it's not me and it's you, what is the mistake that we're going to talk about today?
Well, it's very common to hear a dentist or client of ours say, I like that, whatever that is, whether it's a radio spot or a web page, website. I like it.
Right.
Okay. That sounds good, right?
Right.
But it can lead to some fatal mistakes, because in the end, it doesn't matter what you like. And in fact, Mark, it doesn't matter what you and I like.
I agree. I agree with you, Howie. I agree. I don't like most of the stuff that we put on the street that works.
Right. Even if we create it.
Right. I know. Exactly.
So that leads us into, what does matter? And that's the response. How does the target audience respond to whatever the practice puts out, whether it's Facebook or website or direct mail or what's the response?
Right.
And that's the determining factor. That, and also, we don't want to put out anything that makes the client look like a clown. It has to be professional.
Exactly.
But once that standard has been reached, then it's all about how it's responded to.
And testing.
Yeah, and testing.
Right. And actually we can shorten up the mistake from I don't like that to I don't like or I don't. Because how many times have we heard a client say, I don't click sponsored ads on Google? I don't use Facebook. I'm not on social media. I never look at my direct mail at home. I don't like that way. In other words, they're all judgments. They're all very individual, subjective judgments. And when a dentist uses individual, subjective judgments to guide their advertising, no matter what, no matter what aspect of advertising they're judging, it is, well, ultimately going to be a very, very expensive subjective judgment.
Correct.
Because the judgments are everywhere. Deployment timing. Well, I wouldn't want to get 4 of those a year. Right? Okay. Or maybe I know dentists over-promote, many of them over-promote. They make a classic mistake of over-promoting to their existing patient base. And they say things like, well, I wouldn't mind 12 emails a year from my dentist.
Right.
Well, it doesn't matter. Okay? It doesn't matter what you like or dislike. That's why we had Howie start this conversation, because he's so much more gifted and talented at being nice. And then I come in and say things like, it doesn't matter what you think or what you like. Okay? The only thing that matters is what works and what doesn't work. The only thing that matters is what gets a patient to come into your office and actually start a conversation about dentistry rather than price. Isn't that the only thing that matters, really? I mean, isn't that the ultimate? To have a patient walk into the office and open up a conversation about, I don't know, pick something, implant-supported dentures? Isn't that every dentist's dream, is to have a patient come in? So does it matter if you like the advertising? I know it matters if it's classy. I know it matters if it's high quality. I know it matters if the image is ultra professional. Let's all just agree that all those things are met. Okay? It doesn't matter if you like 12 emails from your dentist or not. We're telling you 4 is about the limit, statistically. It doesn't matter if you open up your direct mail. If you drop 5,000 pieces, we don't even care if 4,980 people throw away your direct mail. All you need are the 20 that didn't. You see what I mean? So be very careful as you go through your dental advertising career to catch yourself saying, I don't like, or I wouldn't do this, or I don't watch that, or I don't read my mail, or I don't click on sponsored ads, or I don't use Facebook. Because if you do that, you will absolutely needlessly spend too much money on your advertising. Because it's really not about you, the listener to this podcast. If our job was to promote to dentists, to get them to react to something, we'd be having a different podcast. Our expertise is getting the dental consumer to have an elevated level of trust and respect for you, up to the point of becoming interested in one of 8 or 9 things, just enough to dial 7 phone numbers and have a conversation with your front desk. We don't promote to dentists, we promote to dental consumers. And what we know is that they are very fickle, and almost never what you like lines up with what works.
Yeah, exactly. And it makes sense. Dentists understand that there's a learning curve in learning how to be a dentist. It's called college and dental school.
Right.
You arrive at the point where now you're going to promote your services. Don't you think that there's a learning curve connected with that? Well, of course there is. The thing that many dentists forget is that, well, yeah, just like you said, Mark, the audience doesn't respond the way a dentist would respond.
No.
It's you know, and if you haven't gone through that learning curve to understand how the public responds to dentistry or fails to respond, then you're just doomed to have to figure it out on your own and spend your own money on testing. And you know, basically, we've already done that for 26 years.
Yeah, well, we will tell you the millions that we poured into it. You're welcome to duplicate it if you'd like, but you're going to end up in the same place. So, yeah. So here's, you know, and if you want to test this theory, you know, there's literally tens of thousands of dental websites on the internet with, you know, bloody implant surgery pictures.
Oh yeah.
Do you really think a marketing company directed that? Of course not. Okay, that a dentist liked that because the outcome was wonderful, and the dentist obviously wanted to share it with their colleagues. But that's there for the public to see. The public doesn't need to see that. That's not going to do anything but scare people away. So you can see examples literally everywhere. We see them all the time. We hear them all the time, and it's not just one mistake. This is the second podcast on mistakes dentists make when they're doing their marketing and their advertising. And the first one was about budgeting or lack of budgeting, allocation, putting in the right mediums, and that is a number one classic mistake shared by hundreds of thousands of dentists. But I really do believe, Howie, that the second most popular one is directing what they like, directing their website developer, directing them with words, images, placement, priority pages or not priority pages. Those shouldn't be dictated by what a single dentist likes. Those should be dictated by statistical fact. What does the consumer value most to least? What gets the consumer to act most to least? Those are statistical facts. Those aren't feelings or senses or things that we like. They're just numbers, right? So now you can add in, and you know, if the dentist comes to us and says, I want to highlight my work with the benefits of dental implants in my practice, sleep apnea treatment, and we also do short-term ortho, 6-month smiles in my practice. And I want to prominently display them because I'd like to expand that part of my practice. Okay, that's different than just liking those things. Okay, you know, promoting it in a well-balanced, non-obtrusive, complementary way is what needs to be done there. But if a dentist likes it, they could tell someone to just promote these 5 things or put these 5 things on my homepage and bury the Meet the Dentist page, which is the number 1 page hit by every visitor of a dental website in America. So be careful. That's all we're saying is when you get to the point where you say, but I like, or I would prefer, or be very careful about your next step because right. Your next step could be very, very expensive, needlessly expensive.
Yes, and that's why we've developed this, I don't know, what do you call it, a grid pattern or it's the marketable attributes scorecard. You remember that, Mark?
Well, it's going to be on our new website for free for people to download. So, yeah, as soon as we get it, probably in another 2 weeks or a week or so, it'll be up there. We would strongly recommend you use it, but go ahead, Howie.
Yeah, and I just to briefly describe it, you know, the practice has marketable attributes. They're not always what you think they are, but this scorecard will tell you what the response from the public has been in regards to which marketable attribute.
Right. It's a number. It's a value number. The consumer values this at X.
Yeah.
Right. Anywhere between, I think it's 1 and 28, I think. Yeah.
Some of the things that Dennis might think are very marketable turn out to be not so marketable or not as important as certain other ones. And what we attempt to do and what our design team does is to arrange the practice's marketable attributes in the correct order with the correct mix, covering several different categories.
Right.
And that's going to cast a wider net and be much more attractive to the dental consumers in your area than just hit and miss. Let's promote this. Let's try that. Blah blah blah. So that's the purpose of that scorecard.
Yeah, the scorecard, and ultimately, all of us, Howie, you and I, for our company, and every dentist listening to this podcast, we all pay advertising dollars for space. If you really think about what you pay for, that's basically what you're paying for. When you have a website, you're paying to occupy space. When you have direct mailer, you're paying for a certain size of space. Same thing with a paid ad, sponsored ad on Google. You're paying for space. A directory that's online, Facebook, I don't care what it is. You are paying for space, to be seen, to be visual. This scorecard will allow you to use the space efficiently. That's what this scorecard does. So that you don't have to keep trying this and trying that and the expensive testing when the recipe book is sitting right in front of you. So the marketable attributes scorecard that Howie mentions in this podcast, our own design team follows it as a rule. With almost everything that we almost without fail, everything that we produce, right? I mean, it's certainly they follow it with our websites, our mailers, our magazines. They certainly use it with single topics to determine what the highest priority single topic is if the doctor hasn't determined it for themselves already. So this is a very valuable tool. It's an Excel spreadsheet. It'll be on our new look and feel website here in about, I don't know, week or two. And so feel free to just log on. I think you have to put your name and email address in there, and then we just email it over to you. But that's very, very, very valuable. It's okay if we're not your marketing company, but you could actually take this spreadsheet and give it to your marketing company and tell them to follow it because they need to. Because if they don't, then somebody's wasting somebody's money somewhere.
Yeah.
So, and classic examples there are how we touched on it, but I'll expand a little bit. There's a numeric value to things like dental services, individual dental services. In other words, what matters more to the average dental consumer? The fact that you treat children or the fact that you do dental implants? The answer is none of you know. And the scorecard will have the number. What matters more, price or the fact that you participate with their insurance? Very interesting. Actually, we could probably do 5 podcasts on that very subject, Howie. Actually, let's write that down.
Yeah.
So we'll do like a series of podcasts on price and why patients only ask about price and why dentists don't tell them about anything else, and we'll do a whole series of podcasts on that. But the point is that dentists come to us and they say, or at least when we look at advertising, dentists come to us and say, hey, will you help me with my advertising? And we always say, well, are you doing any advertising now? And they usually say, yeah. And we say, oh, well, can we see it? And they say, here's my website URL and here's my mail or whatever else I'm sending out. And it's almost always self-directed. And it's almost always about services. And that makes sense. If a dentist is directing their own advertising, it makes absolute perfect sense. If I'm a dentist, I offer services. If I'm paying for space, I'm going to fill the space up with my services so more people choose me. It makes absolute perfect sense. It's also an absolute waste of money. Because dental services are actually, out of the 5 main categories, they are number 4 in importance. So there's an example of a dentist directing their own advertising that may, very likely, would have over-allocated space to talk about dental services. And you might be saying to yourself right now, well, what else am I going to talk about? Howie?
Yeah.
What else makes a dentist marketable?
Conveniences.
There you go.
Actually, according to the, we did a consumer study a few years ago, just trying to determine what the public thinks about dentistry in general and various individual services. And actually, here's a perfect example. What is a more desirable attribute for a busy mom? The fact that you're open on Saturdays, or that you have that you offer sleep apnea treatment?
Right. Exactly.
See? And it's Saturdays. Yahoo!
Yeah.
That makes my life a lot easier because I got kids and I've got a job and I've got a husband and I've got to go here and go here. Convenience is a major concern and interest to 89% of the people who call your practice who are female.
Right. Yeah, so is technology, believe it or not. It's not really the technology itself, it's the benefits that the technology can provide. We joke all the time, digital radiography is 20 years old now? And it's still brand new to 70% of America. They still think it's American dental consumers, not American dentists. American dentists think, digital radiography is old. They think intraoral cameras are way old. Like dinosaur old, Jurassic Park old, right? Why would I waste the space to even mention that, in my advertising? Well, because allowing the patient to see what the doctor sees invokes a higher level of trust and respect. So it's not really the technology. It's what the technology does for the patient. And that's the way you would frame an intraoral camera correctly, the most effective way to get the consumer to respond. So I think we just went through probably 24 mistakes, even though the main mistake was being very careful not to guide your advertising based on what you personally, doctor, like. We would also extend that, Howie. I think you and I would agree that it doesn't matter what your spouse likes, your office manager likes, your 2 assistants like, your 3 hygienists like, the people who clean your office like, your landlord likes, your attorney likes. It doesn't matter what they like either.
Yeah, that's funny you should bring that up. Is when we take on a new client, we actually send them some watch out for this, watch out for that warnings. And I think part of it says, once people find out that you're going to be marketing, well, all of a sudden everybody's an advertising expert.
Exactly. Exactly.
Yes, and promote that, and do what this other rich dentist did 16 years ago, and everybody's got an opinion about it.
Right.
And that's, I guess you just have to have a good sense of humor and nod and go, I'll consider that, and then don't listen to them.
Right. Right. Yeah.
So factor your budget, your marketing budget, on their untested ideas.
Right, because it's not them cutting the checks.
Exactly.
Right. And that's, whether you use our firm or or a different firm, in some ways it is, from a marketing firm's perspective, it does feel like our money on the line. It's more of our reputation on the line than it is our money, I guess. But yeah, no, your neighbor's not going to care. They're going to say, no, make it green and yellow. Put a monkey with a parachute on there, dude. That's great. No, I would send 50,000 of them, 80,000, 100,000, because it's not their money.
Right.
They're not nearly as concerned with results, and they're much more concerned with the subjective of whether or not they like it. Your patients will tell you as well. They will tell you, probably a better indicator of whether or not advertising is resonating is if your own patients come in and say, hey, I heard your ad on the radio, I like it. Or, hey, I got this in the mail, I like it. Or, hey, I was looking for your phone number before my appointment yesterday, and I went to your new website, and I like it. In other words, your own patients will tell you if they like it. And isn't that really more important, what the consumer likes? Really. I mean, that's the bottom line.
All righty. Well, I think we've covered that mistake for now.
Have we hammered them into oblivion completely?
So,
doctors, we're not calling them mistakes. We're just calling them, I don't know, just stuff that we've seen over and over and over again that make doctors get in their own way. And believe me, Howie and I, we own a business. We advertise. We look and judge our own advertising to try and get more dentists to call us. You're not alone. We own our own business, right? And we're judgmental on what our stuff looks like. We want it to look clean cut, professional, and classy, and but it also has to be effective. We've often looked at each other and said, we don't even like our own advertising, and then we crack up because we're starting to make the same mistake that we teach our clients not to make, right? So we're all in the same boat, but just be very careful, because that's a very dangerous path to go down, is to direct your own advertising based on your own subjective likes and dislikes.
Great. Well, we're going to sign off now, and we'll talk to you all very soon.
Bye-bye.
We hope you've enjoyed our podcast today. You can find more podcasts on our YouTube channel, on Stitcher, and iTunes. Also on our websites, dentalwebcontent.com and New Patients Inc.